So I've been a nurse now for over 40 years. This is honestly the best job I've ever had in my career. Like 44 years, started out as a medic in the service, and they paid for my education, became an RN, went back to school, got my master's degree. It's just an amazing place to work. We help people that have been in the system quite a while and have been maybe in and out of the hospital quite a few times. So the clients we see have very serious mental illnesses. And it's amazing the way the team can come together and form a plan to help these people, have a life outside of the hospital. And I used to work in Trenton Psychiatric Hospital too. And I remember as an APN there, I thought, how the heck could these people ever survive outside of the hospital? But it was coming here where I finally saw how that actually really happens. And it's a beautiful collaboration. And I just love my teammates so much. They make me look good.
Years is an amazing period of time when you think about having the privilege of serving people in the community and walking beside them, having them ask you to be their partner in terms of getting better. I mean, that's a really exciting situation, and it's really an honor to be able to be here and be a part of that.
It's hard to believe that Ocean Mental Health Services has been here for 60 years now. We have grown quite a bit in that period of time. We're now up to 48 programs. We do about 12,000 patients a year. So I think we see a significant portion of the community. Mental health problems are really coming to light now. People are acknowledging them. The concept that we should hide our issues like that is lost, and people are really kind of fighting the stigma of mental health problems. Depression and anxiety are some of the most common illnesses in the world. In fact, there are more scripts for depression written every year than there are any other illness. So we all suffer these things. We want to be very involved with all aspects of the community. I probably have at least 24 staff who spend some of their day, every single day, working with various groups, both civic and volunteer groups and governmental groups throughout the county, in terms of what are the issues in the community, and how do we address the mental health and addiction needs of those communities.
One of the programs that has been the foundation for community-based mental health services is the outpatient department. And here at Ocean Mental Health, we have 4 different locations in Manahawkin, Toms River, Bayville, and Brick. We've grown over the past couple of years to include Toms River and Brick, just really to respond to community-based needs. And in those offices, there's individual therapy, group therapy, family therapy, prescribing, assessment of people. It's really the service that provides continuity and stability for people.
Well, we started with outpatient counseling services 60 years ago, quite honestly. But we also have lots of specialty programs as well. We focus on people with serious mental illnesses. So we have a day treatment program for that. We also have a day treatment program for addiction services as well. We also provide residential services. In addition to a couple of 24-hour supervised group homes that we run, both for adults and for children, we have program apartments that are supervised in the community. At this time, we serve about 240 program beds, we'll say, throughout Ocean County. It's almost like a small hospital. And we do basically everything but inpatient care. So the residential components become very, very important to us.
Whenever you're ready, we're on. My name is John LENDIS. I'm the Quality Management Coordinator with Ocean Mental Health Services. I've been here about going on 6 years now.
My name is Tom FINNERTY. and I've been with Ocean Mental Health Services since 2004, and I am the Outreach Services Coordinator.
My name is Brooke Sikorsky. I am the Assistant Director of Clinical Services.
I understand it's our 60th anniversary as an agency. And I have to say the one thing that I love the most about Ocean Mental Health Services is the way that they treat their employees. It's a great place to work for.
I think Ocean Mental Health has really kind of evolved and grown with the community needs that have presented themselves. I started off here 12 years ago as an entry-level social worker and really seemed to make a career out of it. From then to now, the mentoring, the supervision, the growth of the agency, the needs of everybody in the community, Ocean Mental Health always seems to be the first to jump in and try and work with it, change it, help it, meet the needs of anybody that is out there.
The reality is we've come a long way in mental health treatment, and reality is we have a long way to go, and I hope that things keep evolving. One of the biggest things I think today has to do with stigma. So that is a big piece, and one of the things I always try to communicate to the consumers, the people I come in touch with, is just recognition of everybody as a fellow human being.
I have to say we probably have some of the biggest hearts, the most compassionate people in the area working for us, and you know, we practice what we preach here. Whereas we try and educate people and help them get what they need through family, through supports. We really provide it for one another as well. You know, so many of us have started off here so young, had families, gotten married, gotten divorced, and then we rally around one another. So again, it's not just the work that we do for the consumers, but also the work we do for one another.
I think that human touch is one of the most important things, and getting rid of the stigma, and hopefully that will help more people come out and seek mental health treatment and improve the treatment that we give them, so we're not thinking of ourselves as just providers or counselors or whatever, but just as fellow human beings helping another human being.
And I really love what we do. I believe in our mission, I believe in our vision, and the bridges and the crossroads that we're building throughout all of our communities in Ocean County, the networking that we do with our various police agencies and community resources, and how we link all of our clients to ongoing services and not just their basic mental health needs. You know, we view all of our communities as we do our clients. You know, our clients' families, our consumers' families, and the various townships that they all reside in. And, you know, God willing, they'll have another 60 years. I won't be here, but somebody will. Thank you.
Thanks.
We have grown a bit this past year. One of the largest grants that we got is from the federal government, from SAMHSA. It's a CCBHC grant, or Certified Community Behavioral Health Center. And that is both a federal grant and as well as a federal designation that allows us to provide behavioral health, meaning mental health treatment, substance use treatment, and then also primary care, all under one roof. So it's really the opportunity to be able to serve people, to serve the whole person and all of their needs.
Well, we know that after the first Iraq War, that a lot of our veterans came back with issues. But I think our veterans have always come back with issues, and now we're talking about them more. Again, the stigma has been kind of lessened. We're able to talk about these things. So we became very interested in services to veterans. We began several years ago working with the county prosecutor's office on a veterans diversion program. So those veterans who had issues in the community, they may have gotten involved with law enforcement, they were being referred to our programs for counseling as opposed to going to courts and going to jail. So recently we got involved with the county and wrote a grant to SAMHSA for the Phoenix program, which really works intensely with veterans who are in this same type of a situation. That Phoenix program got off the ground on January 1st. It really expanded all of our veterans diversion programming, and we're really happy to see that it's really helping a lot of veterans today.
The Phoenix program, which started in January, is a program for it could be active military, men or women, or reservists, or vets who've already served in the military and now they're army discharged and they're living in civilian life. Really to help them, get medications, to get therapy, to get a job, whatever they need for us to provide services for the family. You don't really see that a lot, for the family members, for the kids, because they also have gone through what they've gone through with so that's why the program started. And they know that they can call us or we can help them out and really give them a second chance.
Because it really utilizes a lot of the peer-to-peer aspect in their recovery, which just, there's so many benefits, and it's just been statistically proven of the benefits for peer-to-peer. It's just kind of like that whole adage of, you walk a mile in my shoes kind of thing. You would have no idea what I've experienced if you haven't walked a mile in my shoes. So by pairing people that have very similar experiences and being able to kind of communicate those experiences together and kind of be able to live that same ground and walk those experiences together, it just facilitates an overall environment of recovery. I spent 18 years in the Army. I deployed 5 times, Iraq, Afghanistan, Kosovo, and twice to Africa. And I was medically retired in 2015 from injuries I sustained in Afghanistan. The fact that we have these individuals that are all going through all of these different things, and they're still going through this program, they're still reaching out to their mentors, and they're still, coming here to OMH, and they're still, talking to their counselors. Those are all success stories. They're still doing the right things, and they still want to be helped. That's awesome to me.
That's one of the programs that is close to my heart, because I think that being able to be a part of helping people who were brave enough to stand up and say, I'm going to go and I'm going to leave my family and the people that I love to make sure that you're safe and that you're going to be okay. Having the ability to walk alongside them and help them to be able to make life easier for them and make sure that they're getting everything they need all under one roof has really been exciting.
Our children's programs have also grown dramatically over the years. We run a day treatment program for children, adolescents. We have a group home for adolescents. We have a lot of counseling services that we work with the Division of Children and Families with providing counseling to kids who have real problems. Our most recent children's program has been what we call KFT, or Keeping Families Together. And it's become a really wonderful program. We have 40 families that we're working with right now in that program.
So involvement with the child welfare system is often a very cyclical process. And so in working with our families in particular, I think it's very important to remember that not everybody had an upbringing where there was somebody to model to them how to be a parent, how to appropriately discipline children, how to sustain employment. And so keeping that in mind is really, really important when working with these families. I had a situation where I was in a family's house and I was working with them to really come up with a budget. They do have some financial responsibility. 30% of their income is their responsibility towards the rent, utilities, food, all of these things. So I was able to successfully connect her with Board of Social Services, where she started receiving TANF. So I discussed with her, sitting down to do a budget to make sure that her funds are being allocated appropriately. And she really looked at me and kind of paused and said, nobody ever taught me how to do this before. When you don't have any money, you don't know how to manage money. And that really resonated with me in terms of sometimes we really have to take it back to the basics. And it's not because these families don't want to be successful or they don't, want to grow, but it's that they just really never had anybody sit down and take the time and teach them.
It felt like I could come so far, but I couldn't succeed in getting to my end goal. I didn't expect them to come and get me or to find a place for me to stay or any of the things that they did for me. They said they saw this potential in me, and nobody had ever seen anything in me other than I was Jasmine, and I kind of took their ball and I ran with it. It's okay, so I have a chance here. I want my daughter home. I want to live a normal life. I want to go to college, and I want to make something of myself and take this horrible, horrible experience that no one should ever have to live through and turn it into something good. It's the best feeling I've ever had because I've never had that. Nothing was really ever expected of me. I was supposed to just go off and get married, and then I was my husband's problem. And I don't ever do what I'm told to do, so I didn't. And to have people that didn't even know me see that in me is like the greatest feeling ever. You know, just to see someone want to see me succeed as much as I do. It's a gift that I can't explain. It's beautiful, you know. And there's something special about these people. They help every person as if it's a member of their family. They give everybody the same, you know, okay, well, let's see how we can make this better. They try and work with every person to see what their needs really are and to get them where they need to be.
So my name is Kathy Greene. I'm the Director of Adult Residential and Community Outreach Services. I have been very fortunate in the past 21 years to have been part of the design and implementation of many programs in the agency. SHARE, Crisis Diversion, CREST, Chelsea House, Beach, WAVE, all which offer tremendous support to our consumers in the community. I think it is amazing that Ocean Mental Health has been around for 60 years, and they are such a big player in the community, sometimes not so known as for what they do, but the consumers we help, we have been so fortunate to see such success and such growth, and people maintain in the community where without those supports they may not. So happy anniversary, Ocean Mental Health.
Thank you so much.
My name is John VOWTERAS. On the Board of Trustees.
What are your thoughts about 60 years of OMHS being in the community, helping the community?
Yeah, it's a long time. A lot of people that they've served. I think I've been a board member about 8 years, and in that 8 years, because of the leadership, it's grown a lot. And I think one of the most satisfying things for me is countless times that people have come up to me knowing that I'm a board member and just told me stories about how the services that Ocean Mental Health provides has really changed their life or a loved one's life and turned them on the right path and really changed their lives for the better. So I think that's been the most gratifying part of all of it. Yeah, it's just helping people.
Okay, my name is VITO GIRONDA, and I'm in the transportation area. I'm a van driver, and I've been here 5 years, and my responsibility is to get the clients to and from program.
Why do you think an organization like this one is so important in our community?
Well, I think it's because there are so many issues today and so many items that are out there for the people, no matter what age you are, no matter what your financial situation is, it doesn't matter. And it's good to get them and get the people here. And there's many things that are offered here for them, no matter what their situation is.
You have an interesting role because you bring the people in, and then I guess you get them back to where they live.
Yeah, it's important. You always want to have a positive attitude, especially first thing in the morning, because you want to start the day out positive for them to come here. Very important, I think, and try to do open discussions if they'd like and things of that nature. It's very rewarding, too, to see them grow and ultimately go on with their lives.
What did you do before you came to work here?
I worked in New York City in the financial district.
Oh, wow.
I was involved with international trade.
Wow. This is very different.
Yes, well, one day I wanted to give something back, and so I started out here as a volunteer.
Wow, beautiful story.
Oh, thank you.
Thank you.
Okay.
Have a good day.
You do the same. Thank you.
So my hope for the legacy when people think about Ocean Mental Health Services is that they'll say that there were a group of people who over time worked there, because lots of people come in and out, who cared about what happened to people, who cared about what happened to the community. and did the very best they could to make sure that we were always taking part in building strong communities.